1. In preparing candidates for the Occupational English Test OET, which adult learning principle is best applied when encouraging learners to connect new medical vocabulary to their prior clinical experience? A. Behaviorist reinforcement. E. Constructivist reflection. C. Andragogical relevance. D. Pedagogical scaffolding. 2. When developing curriculum for OET preparation, which strategy best ensures alignment with regulatory compliance standards for healthcare communication? A. Designing tasks solely on general academic English. B. Incorporating authentic clinical documentation and dialogues. C. Using exclusively grammar-focused lessons. D. Avoiding healthcare-related materials to reduce bias. 3. A mentor guiding a nurse through OET speaking role plays should focus primarily on A. Memorization of responses. B. Encouraging improvisation in non-clinical contexts. C. Simulating realistic patient interactions. D. Practicing only grammatical accuracy. 4. In evaluating listening skills for OET candidates, which assessment method most effectively measures applied comprehension in healthcare contexts? A. Multiple choice quizzes on general lectures. B. Dictation of non-medical recordings. C. Case-based scenarios with note-taking and summary tasks. D. Memorization of medical terms. 5. Which principle of adult learning is demonstrated when learners are encouraged to self-assess their OET practice test performance and set personal goals? A. Dependency on teacher authority. B. Active participation in evaluation. C. Reliance on rote memorization. D. Passive reception of feedback. 6. During OET writing practice, which evaluation method most closely mirrors the authentic test environment? A. Oral presentation of referral letters. B. Group debate on healthcare issues. C. Timed production of profession-specific written tasks. D. Free writing exercises without structure. 7. A curriculum developer designing OET materials for pharmacists must ensure A. Tasks include irrelevant academic essay formats. B. Role plays involve only general workplace scenarios. C. Activities replicate real prescription communication tasks. D. Grammar worksheets are the sole focus. 8. When mentoring adult learners struggling with OET reading tasks, the most effective technique is to A. Emphasize surface-level skimming only. B. Teach strategies for identifying clinical details and inferences. C. Focus exclusively on dictionary use. D. Reduce reading assignments to short, unrelated texts. 9. Which communication strategy best supports culturally diverse learners in OET preparation? A. Discouraging use of prior healthcare experience. B. Integrating case studies from varied international healthcare contexts. C. Mandating identical role-play scripts for all learners. D. Restricting feedback to grammatical corrections. 10. In terms of regulatory compliance, OET preparation programs should emphasize A. Ethical standards in patient confidentiality within tasks. B. Irrelevant business correspondence writing. C. Non-healthcare related listening samples. D. Exclusive focus on vocabulary lists. 11. Which mentoring approach is most effective for motivating adult OET candidates who feel anxious about role-play assessments? A. Ignoring their concerns to avoid dependency. B. Providing constructive feedback with modeled communication strategies. C. Assigning excessive grammar drills without context. D. Allowing learners to skip speaking tasks entirely. 12. When evaluating OET candidates' writing, an assessor focusing on regulatory compliance would prioritize A. Correct use of healthcare abbreviations and confidentiality practices. B. Quantity of words written regardless of accuracy. C. Creative storytelling with fictional patience. D. Excessive grammatical analysis without context. 13. Which adult learning strategy is most effective in helping learners transfer OET preparation to real clinical environments? A. Abstract discussions unrelated to healthcare. B. Authentic simulations of patient-practitioner interactions. C. Memorization of isolated vocabulary. D. Translation of texts into multiple languages. 14. In curriculum development for OET, which sequencing strategy aligns best with adult learners' needs? A. Begin with advanced tasks before basic practice. B. Progress from familiar clinical scenarios to more complex cases. C. Avoid real-life healthcare contexts. D. Introduce regulatory compliance at the end only. 15. During OET speaking practice, which communication technique ensures learners demonstrate both linguistic accuracy and professional empathy? A. Providing scripted responses only. B. Practicing open-ended, patient-centered questioning. C. Limiting responses to yes/no answers. D. Repeating memorized dialogues. 16. In mentoring sessions, which evaluation approach ensures continuous improvement for OET learners? A. One-time final test evaluation. B. Ongoing formative feedback on authentic tasks. C. Ignoring learner self-assessment. D. Peer competition without guidance. 17. Which curriculum component is essential for aligning OET preparation with international healthcare regulations? A. Inclusion of scenarios involving patient consent and confidentiality. B. Writing tasks unrelated to medical contexts. C. Focus on entertainment-related listening tasks. D. Avoidance of legal and ethical considerations. 18. A mentor notices an OET candidate consistently misinterprets patient instructions in listening tasks. The most effective response is to A. Provide targeted listening strategies and practice with clinical dialogues. B. Assign generic English news podcasts. C. Focus exclusively on grammar worksheets. D. Encourage memorization of past test transcripts. 19. Which adult learning principle is reinforced when OET candidates practice peer feedback on role plays? A. Teacher-centered instruction. B. Collaborative knowledge construction. C. Passive absorption of content. D. Dependence on rote correction. 20. In evaluating reading comprehension, which method best demonstrates an OET candidate's ability to apply information to clinical practice? A. Summarizing non-medical fiction texts. B. Identifying treatment details in case notes. C. Reciting dictionary definitions. D. Skimming unrelated journal articles. 21. Which mentoring strategy supports learner autonomy in OET preparation? A. Providing learners with self-assessment tools and reflection guides. B. Requiring exclusive memorization of model answers. C. Discouraging independent practice. D. Restricting tasks to group-only work. 22. When developing OET listening curriculum, which feature best reflects adult learning needs and regulatory standards? A. Use of authentic recordings from healthcare consultations. B. Dictations of unrelated social conversations. C. Repetitive non-medical vocabulary drills. D. Exclusive focus on speed listening games. 23. In OET writing tasks, which factor is most important for evaluation under compliance guidelines? A. Relevance to patient care and accuracy of medical details. B. Length of the essay. C. Creative use of metaphors. D. Non-standard formatting styles. 24. A mentor encouraging reflection after OET speaking practice is applying which adult learning principle? A. Learners as passive recipients. B. Self-directed evaluation of performance. C. Teacher-dominated correction. D. Exclusive dependence on external grading. 25. Which communication approach best prepares OET candidates for regulatory compliance in real clinical settings? A. Practicing empathetic patient explanations using plain language. Using overly complex jargon to demonstrate vocabulary. C. Avoiding sensitive topics like consent. D. Limiting role plays to scripted exchanges. 26. Which feature distinguishes the Occupational English Test, OET, from other English proficiency exams? A. It tests only general academic writing skills. B. It focuses on language use in healthcare contexts. C. It excludes speaking tasks. D. It is designed for children entering schools. 27. When preparing candidates for the OET speaking subtest, what is the most effective instructional focus? A. Memorization of model dialogues. B. Practicing role plays that mirror patient interactions. C. Studying unrelated academic debates. D. Translating healthcare terms into multiple languages. 28. Which skill is specifically assessed in the OET writing subtest? A. Writing opinion essays on global issues. B. Composing referral or discharge letters in clinical settings. C. Drafting resumes and cover letters. D. Producing creative stories for patient education. 29. A nurse preparing for the OET listening test should practice: A. Understanding medical consultations and note-taking. B. Listening to unrelated entertainment podcasts. C. Memorizing lists of random vocabulary. D. Skipping patient-centered dialogues. 30. What principle of adult learning is best applied when learners analyze their mistakes in OET practice tests to improve future performance? A. Dependency on teacher correction. B. Self-directed reflection and goal setting. C. Passive memorization of answers. D. Avoidance of feedback.